The world watched in fear as news of a novel virus, VX25, spread across the globe. First detected in a remote village in the Amazon rainforest, VX25 quickly became a global concern. The virus's rapid transmission rate and severity sparked alarm among health officials and governments worldwide. The WHO classified VX25 as a public health emergency of international concern. Scientists and researchers mobilized to understand and combat this new threat. VX25 highlighted the interconnectedness of our world. In an age of globalization, a virus could spread from a remote village to bustling cities in days. The world braced for a pandemic that could disrupt lives and economies on an unprecedented scale. Initially, VX25 presented with flu-like symptoms, making it difficult to distinguish from common seasonal illnesses. Symptoms included fever, cough, fatigue, and muscle aches. Symptoms appeared within 2 to 14 days of exposure. Researchers found VX25 could lead to severe complications. Some developed pneumonia and acute respiratory distress syndrome. Severity varied by age, health, and immune strength. Elderly and those with pre-existing conditions were particularly vulnerable. This heightened the urgency to understand the virus and develop treatments. VX25 proved to be highly contagious, spreading primarily through respiratory droplets released when an infected person coughs, sneezes, or talks. These droplets could travel up to 6 feet and infect individuals within close proximity. The virus could also spread through contact with contaminated surfaces. Studies showed that VX25 could survive on surfaces like doorknobs, countertops, and smartphones for up to 72 hours, highlighting the importance of frequent hand washing and surface disinfection. Air travel played a significant role in the rapid global spread of the virus. As infected individuals traveled to different countries and continents, they unknowingly carried the virus with them, leading to new outbreaks in previously unaffected areas. The ease with which the virus could spread through the air and on surfaces made containment a major challenge for health authorities worldwide. Governments worldwide scrambled to respond to VX25. Countries implemented travel restrictions, border closures, and quarantine measures. Public health campaigns educated the public about the virus. Hospitals increased capacity and stockpiled supplies. Governments boosted funding for vaccine research. International collaboration was crucial for vaccine development. The world watched, hoping for a breakthrough. Section 5. A global lockdown. As VX25 cases surged, countries implemented nationwide lockdowns. Schools, businesses, and public gatherings were shut down. People were urged to stay home and practice social distancing. The world adjusted to a new way of life under lockdown. Lockdowns aimed to flatten the curve and prevent overwhelmed healthcare systems. Businesses closed, leading to job losses and economic recession. School closures disrupted education for millions of children. Isolation and uncertainty took a toll on mental health. Section 6. The vaccine race. The scientific community worked tirelessly to develop a vaccine for VX25. Researchers explored various approaches, including inactivated vaccines, live attenuated vaccines, and mRNA vaccines. Clinical trials were conducted with unprecedented speed to assess the safety and efficacy of vaccine candidates. The world watched with a mix of hope and anxiety as each stage of vaccine development was met with both progress and setbacks. After months of intensive research and development, several promising vaccine candidates emerged. These vaccines, developed using cutting-edge technologies and rigorous testing protocols, offered a glimmer of hope in the fight against VX25. The next challenge lay in manufacturing and distributing these vaccines on a global scale, ensuring equitable access for people in all countries, regardless of their economic status. Section 7. Protecting yourself and others. While awaiting a vaccine, it was crucial to protect against VX25. Practice good hygiene, including frequent hand washing for at least 20 seconds, or use hand sanitizer with at least 60% alcohol. Wearing masks in public became the norm, and maintaining 6 feet distance was crucial. Avoid crowded places and poorly ventilated spaces. Section 8. Unity in the face of crisis. The COVID-19 pandemic tested the resilience of individuals, communities, and nations. However, amidst the fear and uncertainty, stories of human compassion, resilience, and innovation emerged. Frontline healthcare workers risked their lives daily to care for the sick and dying, working tirelessly under immense pressure. Essential workers ensured the continued functioning of critical services, keeping societies afloat during lockdown. Communities came together to support each other, whether by delivering groceries to elderly neighbors, checking in on isolated individuals, or donating to food banks and charities. The pandemic highlighted the importance of social connections and the need for collective action in times of crisis. It underscored the interconnectedness of humanity and the shared responsibility to protect the most vulnerable. Section 9. A hopeful future. The emergence of VX25 highlighted the importance of investing in public health and global cooperation. The pandemic spurred innovation and collaboration on a global scale. Rapid vaccine development and telemedicine showcased humanity's adaptability. Emerging from the pandemic, there was cautious optimism. Lessons from VX25 will shape future health responses. If you found this video informative, please like and subscribe for more updates.